so don't say anything bad about me because it's being recorded. We'll give them about 2 more minutes and then we'll get started. Oh, there she is. Is that background from The Office? The TV show?
Yes, yes.
I thought I recognized it. When you came on, all I saw was the guy looking through the window there, and I didn't see you. And I actually have real horses standing behind me, so don't worry about it.
Can I ask? Why horses?
Well, let me tell you the story. So way back in the day when we first developed the system, there was no FAB accreditation. And we started getting into FAB accreditation, and everybody said, okay, you got to meet domain 9, which is performance management. And domain 9 is way down the list. And everybody started at domain 1 and started going through. And we thought, shouldn't we be doing all the planning and performance management before we start doing all the other stuff? So somebody came up with the idea, well, isn't that like putting the cart before the horse? So then the horse became the mascot from there on out, and the horse is everything. So, the latest one this was actually our backdrop at our NACHO booth last week or a week before, whenever it was up there. So the horse has been around for a long time now.
Nice. Yeah, I was wondering. I kept seeing all the horses. I'm like, I wonder if there's any significance to that. Or if it was just a random, mascot of the interview.
Actually, my stepdaughter is a professional artist, and she does all of the marketing kind of stuff for us here. So it's really nice to have that. She loves doing the horses.
Nice.
Okay, it's 2:05. Let's go ahead and get started. Anybody else can catch up. And again, we have this program being recorded, so I'll send you over the link to the recording. And then if you need to catch up on it, you can do that. So today we're talking about operational planning, which is digging deep down from where we started out in the system. The core of the system is operational planning. So what we're going to do today is talk about developing operational plans. We're going to talk about the pyramid again, just so we can kind of look at the different levels of the pyramid. So let's go ahead and start out with there. The organization is just your health department. Typically, you never even get to that tab because it's just one element in there. Underneath that, you got your groups. So the groups are the structure of your health department, and typically including the high-level plans that you see up here in the bubbles, what FAB calls their 6-pack of plans. Then underneath each group is a set of services or initiatives. Most of the plans start at the service initiative level. Sometimes, like your strategic plan and such, are independent groups, but a lot of plans start at the service initiative level, and we'll kind of go from there today. Each service or initiative then has a set of high-level goals. Each high-level goal, a set of SMART objectives. Each SMART objective, a set of activities. Now, the nomenclature that you see on here, organization, group, service initiative, etc., is probably the most common nomenclature. However, it's not cast in concrete. Nobody ever says you've got to do it this way. And there's been many, many, many times over the last 15 years that people have come to me and said, here's our plan. Can you help us get it in the system? And all of these names are switched around and things like that. So what I'm going to do is go over just some of those examples. So if somebody does come up to you and says, hey, here's an operational plan we'd like to have in the system, and you look at it and the names don't match, you'll be able to kind of correlate the names differently here. So let's just kind of look at some of those examples. So here's one. Where we call services or initiatives, they're called strategic priorities. And this is very, very common in your strategic plan itself. And then goals are goals. Strategies is a name that you'll see all over the map here. I don't particularly care for it at the objective level because to me, the objective is a target and the strategy is how we're going to get to the target. So I think in this case, strategies and objectives are reversed. But again, I didn't make up the rules here. Strategic areas is a pretty good definition of the service initiative. Goals, outcome objectives. I really like that term because the objective, I think, is what outcome are we trying to achieve. And then the strategies are how we're going to get to the objective. Priorities, goals, objectives, and action steps is a real good, simple definition. Action steps is, by the way, the most common term we see for activities. Priority areas, goals, again, strategies at the objective level, don't care for, but action steps underneath that. Priorities, goals, objectives, and strategies, that's not bad. And then strategies at the top. So you see strategies can kind of, depending on who's doing it, move it all over here. Strategic objectives is a pretty good definition of a goal. It's a higher level than an objective, than objectives and action steps. So again, if somebody comes to you and hands you a plan, you look at it and say, okay, after today, you should be able to identify what the different levels kind of look like in there. And if you have any troubles with that, just get a hold of me and I'll take a look at it and kind of help you to get it structured in the system. So now what we're going to do is we're going to walk down the pyramid. We're going to go to each level of the pyramid. We're kind of look at different variations. And by the way, these are all real live examples from plans within public health. So I just want you to see some examples of each level here. Let's start out with the groups. So again, typically the groups is the structure of your health department. So it's the divisions, the offices, the programs, and how they relate to one another. Most commonly, the department is the top level group. So the groups can be leveled from 1 to 10. So level 1 groups is the top. Typically, there's only one of those. Sometimes we'll have another level 1 group called archive or training because they don't roll up to each other. Level 2 groups. So for instance, we have community health division as an example as a level 2 group. Level 2s always report to level 1. And you can have a whole bunch of level 2 groups under there reporting to level 1. And let's say that WIC, in this particular case of our group screen here, WIC reports to community health. So it's a level 3 group, as you can see, reporting to community health at level 2, which reports to the level 1 group. So WIC can easily be moved up to the department. It's all you do in there in the group screen. You change the what they call the parent group. And in this case, you change it from community health to department, and you change the level from a 3 to a 2, and WIC then directly reports to the department. And by the way, you can do that as much as you want. It doesn't affect anything down the stream in the plans. It just kind of moves things around to make them, the way that your department is organized. Now, as I mentioned, the high-level plans, what FAB calls their 6-pack of plans, are typically groups within themselves. Those are very, very high-level plans. So your strategic plan is one of those. You can see it's level 2, reporting up to the department. Your community health improvement plan, same thing, typically a high-level group. And then we're going to use the same example we used in the overview. Tobacco 2024 is the group that we're going to be working in today. Now, the next level down is going to be services or initiatives. Services, again, are ongoing things that you do as a department. Initiatives are those future things that you want to implement. Example, again, WIC is a good example of a service. WIC is something that's been around forever, will continue to be there forever. Initiative is something that you're planning on doing in the future and you haven't really implemented yet, but you're starting to plan for it here. Again, we're going to use the example of tobacco cessation as our initiative for today. And what I'm going to do now is just kind of go through some real live examples from public health plans, just to kind of give you an idea of what these are. Think of them as buckets. So these are the buckets of plans that are going to get us to this end here. So healthy moms and babies. We're going to have a set of plans that are going to get us to healthy moms and babies. Readiness for emerging health threats. Effective agency processes. Access to care. Behavioral health and substance abuse. Population health. Organizational excellence. Chronic disease prevention and control. Health disparities. And again, for today, the example of tobacco cessation. So again, these aren't really actions if you think about it. This is just what we're trying to accomplish at the highest level here. Now, each service or initiative then has a set of high-level goals. When you think of a high-level goal, try to think simplistic. Typically an action verb followed by a few words. So here's, again, some examples. Reduce the risk of infectious disease. Promote safe and sanitary food establishments. Support communities in building resiliency. Enhance healthcare through technology. Drive health in all policy agendas. reduce the risk of vaccine preventable diseases, promote public health readiness and response, promote succession planning and career growth, integrate a data-driven best practices approach, and then again, we're going to use the example of reduce smoking in high schools. So the example is, if I tell you we're going to reduce smoking in high schools, everybody has a good picture in their head of what that means. What it doesn't tell you is the detail that you need to know, like which high schools are we going to start with? When are we planning on doing this? By how much can we reduce smoking? So that's when we're going to get to the next level. So again, the goals are a high level, fairly simplistic, just a few words. SMART objectives. So again, specific, measurable, attainable, relevant or realistic, and time-based. Primarily focused again on specific, measurable, and time-based. If they're not accessible or realistic, why are we going to go after them here? So here's some examples. By December 2024, identify 2 or more strategies to collaboratively reduce risky alcohol-related behaviors. This, by the way, is where most people have difficulty in creating operational plans, is getting all of the criteria, the specific, measurable, and time-based, into an objective here. So in this case, our specific is the strategies to collaboratively reduce risky alcohol-related behaviors. Our measurement is 2 or more, and our time frame is by December 2024. So it meets the criteria. By December 2024, 80% of educators and school staff have been exposed to ACE awareness education. By June 2024, provide 6 training opportunities for first responders who work with individuals in a mental health crisis. By the end of 4th quarter, all programs will have established goals, objectives, and activities to be reported on within the VMSG dashboard. And then again, we're going to use the example of reduce smoking at good old Wayne High School by 25% by the end of the school year. So again, I think if you look at each of these, you'll find the specific part, the measurable part, and the time base in here. Now, to get to the objective is a target. If I go back here and I tell you, reduce smoking at Wayne High School by 25% by the end of the school year, that's great. We have a good target to get to. We know what we want to do. At this point in time, we have no idea how we're going to get there. That's what the activities are all about. So as we talked about in the beginning, there are 3 distinct types of activities. The most common that you'll use, and the original one, by the way, this was the only one in the system for quite a while, was a project-based activity. So in this case, we're going to say create training content materials for students and faculty on the dangers of smoking. So again, maybe making some PowerPoints, some videos, some user guides, all that kind of stuff. It's a project. Every activity's got a performance measure. How do I know when I've successfully completed the activity? So we're creating training content. Once the training content is created, we're done with the activity. We're typically going to do it within a given time frame. So here's our beginning and ending dates. We're going to assign a team of people to do that, including a team lead. We're going to potentially assign external partners if we're working with external partners on the activity. And then our measurement in this case is pretty simple. It's % complete. So if we're saying that we're going to create 4 chapters of training and we got 2 of them done, we're about 50% complete. Now I'm going to get down into some real detail because we're actually going to take this plan and enter it in the system so you can see everything we need to do to enter it. I'll show you all the different measures that you can do in the different types of activities. So there's a lot of different variations in there. So that's the first one, and this is the one you'll be using most often. The second activity, and kind of out of order, is usage, but this is the least used type of activity, quality assurance activity. The reason it's least used is because it's very specific. It's something that's repeatable. In this case, we're saying provide 9 training sessions each month. So we're repeating it on a monthly basis. We call that a frequency, by the way, and that can be anywhere between weekly and every 5 years. On the dangers of smoking to students and faculty. The other thing that this activity does is because we have a lot of information, we can set the traffic light automatically. So if we get to that 9 training sessions during the month, it's going to set the light to green. And we pick a number of 6, saying that if we only get to 6, we're saying that's not good enough, we're going to set the light to red. And then you can imagine 7 or 8 is going to end up being yellow in there. So this is used in a specific situation where you need these 2 things. You'll notice we have a cycle start date, no end date, but a frequency. So if our cycle start date is May 1, and the frequency is monthly, then the end of May is going to be the end of our cycle, and then it's going to move into June, and the end of June will be our cycle. So there's always an end date in there. However, in this case, it's calculated each time. Our performance measure is going to be training sessions provided, measured monthly, and on a green, yellow, and red value. So the performance measure in this type of activity is actually created for you. We'll show you how that works in a few minutes here. And then again, we're going to do the team assignments, partner assignments, and our input metric or measurement is going to be how many training sessions did we provide. So that's the QA activity. The third one here is what we call a quantitative measurement activity. The difference between this and a project-based activity is pretty simple. Target quantity. So in this case, we're saying contact all 20 tobacco vendors within a mile of Wayne High School to ensure they're not selling to minors. So if we have a target quantity and we say we've done 10, we know that it can calculate it to be 50% done. So that's kind of why it's in there. But you'd be surprised at how many things you'll find that you actually count. Number of vaccinations, number of medications distributed, number of car seats installed, that sort of thing. So that's where this one gets used a lot. Other than that, basically, it's the same as a project-based activity. So it is the second most used type. You're going to have a beginning and ending date. You're going to have a calculated performance measure that says 20 tobacco vendors contacted between May 1 and June 30th. And then again, we're going to do team and partner assignments. And as you can imagine, our metric in this case is real simple. How many vendors did we contact? So those are the three types of activities. Now, you'll notice at the bottom of each screen, I put the last thing from the tobacco program in blue. So what I'm going to do now is kind of build that program in a bullet fashion here so you can see how it all lays together. So the group we were using was tobacco programs for 2024. Underneath that, we had several different services or initiatives. In this case, we chose tobacco cessation. Under tobacco cessation, we had a goal of reduce smoking in high schools, plus several other goals. Under the goal, we had the objective of reduce smoking at Wayne High School by 25% by the end of the school year, and then the activities to get us there: create the training content, provide the training sessions, and contact the tobacco vendors. Now, a plan like this can be replicated at any level. So we talked about we had multiple services or initiatives. So I might have a second service or initiative in there and then build a similar plan underneath that. I might have another goal. So for instance, I might have reduce smoking in colleges as a separate goal. And then underneath that, I'd have a similar objective of reduce smoking at good old Wright State University by 25% by the end of the school year. And then under that, I'd have similar activities to get us there. So again, you can kind of repeat this at any level and the plans can get very long, and hence the reason we have the pyramid model where the activities get pretty wide at the bottom here. Now, that's the plan that we just created here. This is an operational plan template, and it should have been attached to the meeting invitation that you guys got. There's a blank version of this. This was, again, actually created by one of our health departments in Wisconsin. And the reason they did it is because some of the guys weren't comfortable going into the system yet, and they also wanted to create a plan and then take the plan and pass it around to their peers, get everybody's input on it, and then go and put it in the system. And that's one way you can do it. You can also just go in and start entering the plan, and it's pretty easy to move things around once you get it in there. But in this particular case, this template is pretty nice because as you're using it, it gives you kind of that quick definition of each level. So at the service initiative level, it says, what bucket of work or priority does this relate to? Tobacco cessation. Our first goal, what is your pie in the sky or high level goal to reduce smoking in high schools? Then we get down here to the SMART objectives. Specifically, what and when do you hope to accomplish? Our objective lead is the person who's going to guide us, who's going to get us there. The activities then that roll up to the objective are what are the steps you will do to accomplish the objective? Each activity is going to have a performance metric. How will I know that we've successfully completed the activity? And then the activity leads are the people who are going to get us through the activity, which will get us to the objective. So what I'm going to do now is I'm going to take this plan and I'm going to enter it into the system so you can see everything that you've got to do to enter it. Pay attention to this part of it because there's going to be homework at the end of this session. And the homework is for each of you to go in to the training group. You all have full access to it. I created it this morning. You all have full access to it. And I'm going to ask you to create a very simple little operational plan. When I say simple, it typically means one service or initiative, one goal, one SMART objective, and potentially, if you can think about how to use the three different types of activities, put those in there, or at least, a couple of activities that'll get you there. So we'll talk about that in a few minutes here. So let's go ahead and let me get to the actual template. So this is the actual template. It's a Word document. lots of tables, as you can see in here. So the first thing I'm going to do is I'm going to highlight tobacco cessation. I'm going to copy it. Control C on my keyboard is the easiest way for me to do it. I'm going to go back over to the system. And as you can see, we have this training group down here at the bottom, and underneath that, the Tobacco 2024 group. So what I'm going to do, I'm selected the tobacco group. I'm going to go up and select the Service Initiative tab, and you'll see it's empty. Now, I can't add anything unless I hit the plus button first, or this is really just a big plus button, but it blocks you from entering anything. So I'll click on that, and I'm in here, I'm going to hit Control V or paste, and I'm going to paste tobacco cessation in here. The difference between a service and initiative at this level is very simple. It's this checkbox. If I uncheck it, it's a service. If I check it, it's an initiative. Down the road, you're going to see that initiatives produce slightly different reports. The VMSG public, which we'll talk about in the next training session, is going to be a bit different in there. And typically the dates at the activity level are going to be different for initiative. There'll be future dates. So I'll go ahead and save that. So anything you're doing down here at the bottom, by the way, is done on your local computer. It's just the way that's built. Now, when I hit the save button, it immediately sends that information up to the server. What that does is allow you to have a whole bunch of people working at the same time without slowing down the server. So it really doesn't ever have an effect on the speed. Now, over here, something I want to show you, this hide service checkbox in the bottom right. Let's say this program was completed last year, 2023, and I wanted to keep it in there as an archive, but I don't want everybody to be looking at it. So I hit the hide service button and save that, and you'll see that it grays out. When it's grayed out, the only people who can see it are people with manager and org admin level access. Anybody who's a normal user can't even see it. But the manager and org admins can look at it. They can do reports on it. They can do all kinds of things. So it's good to have that as an archive. How did we do in 2023? I'm going to go ahead and unhide that and then save it again. So anything I do at the bottom on any of these screens, I can change it. Then I hit the save button. And by the way, if you try to move without saving, it'll ask you, hey, do you want to leave or do you want to save it here? So that's my initiative. The next thing I'm going to do is go down to my goals tab. And since I have one initiative and it's selected, the goals are going to be specific to tobacco cessation. And again, I got to open it up by clicking down here. Now let's go back and grab our goals. So our first goal, reduce smoking in high schools. Grab that, Control C, go back over to here, go ahead and paste it in there, Control V, save that. Now, at this point in time, there's a lot of other things we have in here, but we're just going to kind of stick with the basics. You can set the traffic light at this point in time. So if we think that we're on track reducing smoking in high schools, we'll probably leave it as green. If we're behind schedule for some reason, now remember we're entering an initiative, which is a future program, so it's kind of tough to be behind schedule when you haven't started yet. But you could be yellow. If there's something that's stopping us from doing this, we can call it red. And once we get completed with this, if that ever happens, we're going to get to gold in here. So we're going to go ahead and leave this as green for now. And I think we have a couple of other goals down here. Yeah, so there we go. Goal 2, reduce smoking in colleges. So I'm going to grab that, Control C, back over here. Now I'm going to hit the plus button to add a new one. You notice it clears out the bottom for me here. Control V, save that. And then we have one more goal of reduce smoking in public areas. Control C. I'll go back over to here again, hit the plus button, Control V, and save that. So I have my 3 goals. Now, to get to the objectives for reduce smoking in high schools, there are 2 ways to do that. Number one is I can click on reduce smoking in high schools and then click the objectives tab. Or you see over on the right, these are called drill downs. So what this means is if I click on this drill down next to reduce smoking in high schools, it's going to select reduce smoking in high schools and take me down to the next level, which is the objectives. Bottom line, it saves you 1 mouse click. But if you got a bunch of things on there, it's kind of easier to go around and about that way. So I'm going to open up my objectives. So I'm going to go back over to here, scroll back to the top. So my first objective, reduce smoking at Wayne High School. So I'm going to grab that, Control C, go back over here, add the objective, Control V. I'm going to go ahead and save that. So now it appears up here, as you can see. The next thing I'm going to want to do is set what are we measuring. So down here, objective % done is the default, 0 to 100%. A lot of cases that stays that way. In this particular case, we're measuring % reduction. So if I click on the little title here, it pops open this window, and I'm going to change this to % percent reduction. My measurement units is just this little field that shows up over here, and it's still percent. But I do have a choice at this point. I can either say we're going to measure it in percent or we're going to measure it in decimal. So if I were at this point in time and I was calculating something, I wanted to contact 20 tobacco vendors at this level for some reason, or anything like that, I could say decimal, and then it's no longer a percent, it's just a decimal. In this case, we're going to say we're going to measure percent. So now you see that the field down here changed to percent reduction, 0% at this point. So we're going to go ahead and say we're at 20%. So we're at 20% reduction. Go ahead and save that. Now, anytime you change this field down here on a plan element that doesn't automatically set the traffic light, like an objective here, it's going to ask you, because you changed this, does it affect the traffic light? Now remember, the traffic lights: green is go, yellow is slow, red is stopped, and gold is completed. We're about 20% out of our 25% target. So I'm going to say we're a little bit behind schedule. I'm going to go ahead and save that. Now I can cycle through my traffic lights with my mouse here, or I can use the drop down here. So I just go ahead and select yellow, go ahead and save it. Now, when I do that, I'm probably going to put a note in here. And my note is going to say system admin, just would be my name if it was a normal user in here. I'm going to say only at 25 or at 20%. Oops, my typing is not too good. Okay, so I'm putting a note in there just so anybody who sees the yellow light will be able to look over here and say, oh, Fred put in a note that says we're only at 20% reduction, set the light to yellow. Makes perfect sense at that point. The other thing we're going to want to do is assign the objective lead. So the objective lead is, again, the person who's responsible for getting us to this reduction, program manager, project manager, whatever, and updating this status. Now, the objective lead will get an automatic email from the real-time planning. Hold on one second, please. Get an automatic email from real-time planning to come back in here and update the status. So typically you'll update the traffic light if necessary, the current status of percent reduction, and potentially put a note in there, and then you're going to hit the save button. So at this point in time, let's go ahead and assign somebody. Now, the reason nobody shows up in this window is because we're in a training group. Nobody's assigned to that group. So I'm going to hit show all users up here. I'm just going to go up here. Let's see. I'll pick Sarah. So Sarah is now the objective lead. So again, she's got two jobs: get us to the target and keep the status up to date here. I'll go ahead and save that. Now you see that Sarah showed up here. So that's most of it. There's one other option on here, and that is the ability to assign a data source. So the data source is, where am I going to go to get the information to update the status of this? Sometimes you don't have such a thing. Sometimes you got to go looking for it, or you got to know somebody or something. But if you should happen to have a place on your intranet, somewhere in your file servers, on the internet, you can set up that data source. Let's assume for a second that we're going to be able to get that information from the CDC Smoking Cessation Fast Facts webpage, which there is such a thing. CDC Now, there is such a thing in there, but I don't have the entire link. So I'm just going to put in the CDC website in here. When you put in a data source link, it's got to start with something like HTTP, HTTPS for secure, FTP, whatever it happens to be. So I'm going to put in http://www.cdc.gov and hit OK. Now you notice that the title shows up down here, and this link is my link to get there. So I'm going to go ahead and save this again, and I'm going to hit the link. When I hit the link, it opens up a new browser tab and takes me right to the CDC website. So obviously this has nothing to do with Wayne High School, but if it were available on there, that's where we'd be going. So the idea here is, if you've got a place that you can go to get the current status of this, why not have it at your fingertips? So you do. So this is our objective, to reduce smoking at Wayne High School. Now, to get to our objective, we're going to put in those activities. So I'm going to go to my activities tab, open it up down here. Let's go back over to here. Our first activity, I've got the 3 different types of activities so we can look at the differences in here. I'm going to go ahead and say, create the training content, Control C, go back over here, Control V. We know this is a project-based activity, so I'm going to leave that in there. The project-based activity is the only one where you manually create the performance metric. So I just happen to have that over here. Once the training content has been created, we're done with the activity. C, back over here, Control V. So training content material has been created. That's how we know when we're done with it. We're going to go ahead and assign a beginning and ending date. So let's go ahead and pick August 1 through August 31 in here. And we'll go ahead and save that. Now, when you update an activity, typically, again, you're going to put a note in there. So let's go ahead and say that since this thing saves, we're going to go ahead and put in a note. This little button right here puts a date and timestamp on the note. So I'm going to go ahead and put in that. And I'm going to say, chapter 1 of 4. To me, that indicates we're about 25% done. So I'm going to put in here 25%. And we'll go ahead and save that. Now, again, it's going to say, hey, are we okay? Is the traffic light okay? And because we are moving forward and we're 25% done, doesn't mean we're behind schedule, just means we're in the process here. So I'm going to leave it as green at this point in time. Now, I can put in another note that says, hey, we're completed chapter 2, mark this as 50% done, et cetera, as we're going through. The other thing we're going to be able to do is going to add teams of people here. So this little pencil icon next to the activity leader and team members box, we'll open that up. Again, nobody's in here because I'm looking at the tobacco group, which nobody belongs to. I'll go ahead and open that up again. So let's pick Diego as our team lead. So when I click the team lead box here, it makes them a team member and by default gives them the email notification. And we'll go ahead and say Christian is a team member working with Diego as the team lead. Then I'm going to go ahead and save that. So now you'll see down here, the L indicates lead, the T indicates team member, and the blue around the L indicates email notification. So in this case, Diego is also going to get an email from real-time planning to come back in and update the current status. So when he does, he's the team lead. So he's going to come in here and put in a note that says, hey, completed chapter 2 of 4, mark this as 50%. And if we're still on track, he's going to leave the traffic light at green as we're going forward. The next thing that we're going to be able to do is add external partners. I don't know if you guys have any external partners in. Oh, you actually do. Great. So let's see if we have anybody with contacts in there. Okay, so there's no contacts associated with anybody right now, but you can have a whole list of contacts for each of these partners. So let's see. We'll just go ahead and use the Love Madera as our partner. So this is the partner organization on the left. On the right-hand side are the contacts within that organization. So right now I'm just going to say I'm going to assign Love Madera as our external partner. And you see they show up down here. And since we didn't select a contact, there's no contact in there. I'll go ahead and save that again just to make sure. So that is our first activity, the project-based activity. Now let's go back and grab our second activity, which is the QA activity. Provide the 9 training sessions. Control C, go back here, hit the plus button, Control V, go ahead and drop this down as a QA activity. Opens up the activity wizard. Now this little guy is the activity wizard, so it opens automatically in this case, but you can also go back to it from this button here. So we're saying provide 9 training sessions each month. So I'm going to set this for monthly, and then I'm going to set the beginning date, probably the beginning of, let's say, month. So we're going to say it's the beginning of August here. Now, this is the value that I can set. I'm going to flip this around here so it's greater than. You notice it can be either less than is green or greater than is green. Think of a golf score. Less than is better than greater than at that point in time. So you can flip it around. In this case, we're going to say if we do our 9 training sessions a month, that's green. And we're going to pick, again, that random number of 6, saying if it's 6, it's going to be yellow or going to be red. And then our metric type here is training sessions provided. So again, like I mentioned, this is going to create the performance metric for us when I save it. So there it is. Training sessions provided, measured monthly, green, yellow, and red. Now down here is our, I'll go ahead and save that. The reason the light is red now is because, in fact, we have basically 0 in here, nothing. So it's marking that as 0. Anything below 6 is going to be red. So if I go ahead and put in a 7 in here, click off of it, you notice the light turns to yellow because it's in between the 6 and the 9, and I'll go ahead and save that. Now, after the first time you enter a QA activity, it's going to assume that you're entering the data for, in this case, the month. So it's going to say, do you want to update the cycle start date? So I've got my choice of leaving it the same, say no, put the current date in here, so it would be what, 8/6 in there, or I can say select the date. So let's go ahead and say, yeah, 7 is all we're going to do this month. I'm going to select the date. So you notice it picked 9/1 as my next date. So we'll go ahead and do that. So now what happens is I'm starting a new cycle at 9/1. So I'm going to go in here and keep track of it starting in the month of September. So it kind of automatically moves those dates ahead by the predicted frequency in here that you've selected as monthly. Now, in this particular one, we're going to be able to go in and do the same thing we did before, the team members and the activity partners. I won't go through that again here. But I want to go back up to the project-based activity one more time. There's a couple of options that I forgot to show you. In the activity wizard, down here at the bottom, you got a couple of them. The default is 0 to 100%. Now, let's say this is something I'm going to be doing the training content in the course of a week, and at the end of the week, I just want to go in and check a box and say it's done. So I select this complete down here and save that, and you notice it changed this to complete with a checkbox. So if it's unchecked, that means it's 0% done. If it's checked, that means it's 100% done. Now, the project-based activity, when it gets to 100% done, automatically sets the light to gold, indicating successful completion of that. I'll go ahead and save that. Again, does the traffic light need to be updated? In this case, no, it doesn't. Now, some cases, this is a continuing thing, so you may not actually want it to be gold, so you can flip it back to green if you need to. Now, there was another option down here that you saw, the yes, no. And if I look at that, it just changes this to a yes, meaning that if it's an activity in the form of a question, have you accomplished this? You can just mark it as yes or no. So unchecked is no, which is equal to 0%, and checked is yes, equal to 100% in there. So I'll go ahead and set it back to our default of 0 to 100%, and you can see it's marked as 100% because we had it set for the other way here. And so that is our first activity. Now, back down to the QA activity. There's some options on there as well that we talked about a couple of them here. I'm going to go in at the end of this and show you this timeline activity. It doesn't apply to this situation, but it's really a cool activity, and I'll show you why in a minute here. But we talked about the different options in here, and basically less than or equal to versus greater than or equal to. So, again, the example of a golf score. So we can set this as less than 3 is green and greater than 6 is red, or something along that line. So that's the flip around on here. And again, I'll come back and talk about the timeline version of this activity when we get back to there. So that is the second activity. Let's go ahead and add a new one here. I won't save that. Go back and grab our third activity. Contact all 20 tobacco vendors within a mile of Wayne High School. Control C. Go back over here, paste it in here, Control V. And we're going to drop this down to the QM activity. So I selected that. So we're going to, again, beginning date and ending date, either place is identical. So it's just kind of redundant, I guess. End date of August 31st. Now we have a target number of 20 tobacco vendors. So I'm going to put that in there, 20. We can select either decimal or dollars. Decimals is counting anything. Dollars is just exactly that. It's dollar signs and 2 decimal points. Our metric type in this case is going to be tobacco vendors contacted. We have 2 options down here. Enter a new value to add to total. We'll look at that one first here. Save that. So our performance metric is created. 20 tobacco vendors contacted between 8/1 and 8/31. When I say a new value, I'll go ahead and save this. When I say a new value to add to total, when I put in, let's say I went out this week and I contacted 5 vendors. I put 5 in there, and it sums up the running total to 5 and calculates it to be 25% done. I go ahead and save that. Maybe next week I come back in, I do another 5 vendors. So I go ahead and put that in there. The running total now is 10, 50% done. So that's what that one's all about in there. Let's go back and flip it over to enter a new total value. And again, this is kind of the situation where maybe one week I'm going to go out and contact all the 20 tobacco vendors. So I just need to have a field to say that I did 20 at the end of the week maybe, and it calculates this to be 100% done. So the only difference is it takes away the running total field and just gives you a single total field in there. And you can use either of them either way you want to. Again, we're going to have the ability to add the external partners and the team members in here. And there's one other kind of a hidden option in here. That's what we call a zero target. So if you have something that you want to count, but you don't have a target number, when I put in the zero target, it can no longer calculate percent done because the target number is your denominator, and now it's zero. You can't divide by zero, so it can't calculate. But let's say you're doing vaccinations. You don't have a target number. You just want to do as many as you can in a month. So at the end of the month, you want to know how many did I do. Gives you that option to be able to put that number in here. And it's all you're doing is counting at that point in time. So there's a lot of things that you'll count, number of vaccinations, number of medications distributed, number of car seats installed, whatever it happens to be, where you don't have a target. So that's the kind of the option to do that in there. So those are the three activities that we believe are going to get us up to that objective. And if we go back again, look at it in the pyramid, it's this way. So the group, let me get them all on here. Our group was Tobacco 2024. Tobacco cessation was our initiative. Reduce smoking in high schools. One of our objectives was reduce smoking at Wayne High School by 25%. And then the activities we're going to go to get there. So that is the way that you create an operational plan in the system. And again, remember, every one of these levels, you can have multiple plans under multiple groups. You can have multiple plans under each service, the goals, objectives, activities. So all this can be there. Now, I told you there was another type of activity I wanted to walk you through. Let's go ahead, and what this is all about, and we talked about this a little bit in the overview, is that standard operating procedures, MOUs, how to manage documents over a cycle of time here. So just FYI, this activity has nothing to do with the plan that we've entered up here, but I just want to enter it and show you what it would look like here. So I'm going to hit the plus button here. I'm going to say update SOP, Standard Operating Procedure 1, annually. So that's my activity. I'm going to go down, select the QA activity here, and I'm going to select the timeline. So first of all, our frequency was annually. We're updating it annually. I'm going to go ahead and say 7/1, so beginning of the fiscal year, I hope that's your fiscal year, is the beginning of our time cycle. I'm going to hit the timeline. Now you notice everything disappears except percent to yellow. So if I want to say I'm going through the year, percent to yellow is percent of the year. So if I were to select 80%, I don't know if that's a good number or not, 80% of the way through the year, the light's going to turn yellow. When the light turns yellow, that means that whoever we designate as the activity lead is going to get notified. That notification is going to take them with a link right back to here to be able to do the update on that particular standard operating procedure. Update SOP. And when I save this, it's going to say update SOP measured annually. It's going to be green, less than 80%. 80 to 100% is going to be yellow. And when we get to 100%, it's going to turn to light red. So what that's telling us is that when we get to 80% of the way through the year, the light turns yellow. When the light turns yellow, that's going to notify whoever we designate as the activity lead to come in and do it. Now, what you're going to do in conjunction with this is you're going to probably add the SOP document, which would be right here with document management. Click on that. So I go ahead and add a document, choose a file. I got a bunch of things in my little test directory here, so I'll just pick health and wellness as our SOP. And I'm going to say upload. So now the file name appears down here. I can call this SOP1. I can put in notes. I can put the traffic light, anything I want to be able to do with it. I'll go ahead and save that. Now, I've got that SOP in there. So when that time comes, 80%, about 9.5 months through the year, let's go ahead and we'll just assign somebody as our objective lead. Let's pick Lori down here for some reason. And okay, so what's going to happen now, 80% of the way through the year, go ahead and say no. Lori is going to get Lori is going to get an email notification from the system. It's going to link her back into this particular activity, either directly or through the quick update. She's going to be able to go right into here and download that current SOP. Once she downloads it, she can do the updates on it that are required for the next fiscal year. She can upload that same file right back, the updated file, back up to document management. Document management will automatically keep version control for her. When she hits the save button, it's going to say, do you want to update the cycle start date? It's going to say, you're going to say yes, and it's going to take it up to 7/1 of 25. the light's going to turn green because we're below that 80% of the year, and the cycle starts all over again. So this is just a really, really nice way to be able to manage critical documents, SOPs, policies, memos of understanding, grant documents, FAB documents, all kinds of stuff in there. What most people do is they'll put a new group out there called critical documents or something like that. Underneath that, at the service initiative level, you might have SOPs as one, and policies as one, and MOUs as one, grant documents as one. And then you build out the plan down to the activity level, and then each activity is one of those documents. So that controls all of the updating of all the documents in your department individually all the way through the year here. So it really is a nice tool. As a kind of a side benefit, everybody can be given read-only access to that group, which means they can go navigate down the group, say, I'm looking for an SOP and I'm looking for an operations SOP, and here it is, I can grab that. They can download the SOP, they can use it for what it's meant to be, whatever that particular procedure is, they can use it. They can't update it, they can't load a new version, they can't do any of that kind of stuff, but they can actually use it. So it's just a really, really nice, cool tool. And by the way, has become the most used feature of the system since we rolled it out about 6 or 7 months ago. So that is the SOP activity, if you will. Now, that is what I had to go over today. And as I mentioned, there's going to be homework. So here's what I would ask each of you to do. I'm going to go back into here. I'm going to go to my groups tab. When you guys log in, you'll be able to see the training and tobacco group. I would like you to go down to the training group, go to services and initiatives, add a new service. And it can be something, and by the way, we've had a lot of fun with this, planning a Christmas party, planning a Las Vegas vacation, planting grass in my backyard, all kinds of different things. You can do something business related if you want to, but if you want to have something fun, please go in and do that. Planning birthdays, whatever it happens to be. So put in, planting grass in my backyard, or whatever you're going to do. In parentheses after that, put your initials so we can know who did what. And then after you get that in there, go down to the goal level and pick maybe just one goal. I'm going to have the best looking backyard in the neighborhood or something like that. And then you're going to go down to the objectives. By the end of summer, I have planted 2 acres of grass or whatever it happens to be in there. And then you're going to go down to the activity level that says, I got to go buy the grass seed. I've got to rake up the yard. I've got to plant the grass seed, whatever that happens to be in there. Just build a quick little plan in there. What we're going to do in the next session, because we have so many people, we'll just have it a session of just reviewing those. But I would ask everybody to enter a plan in the system. Now, to me, hands-on learning is the best way to do it. So when you go in there and you start clicking the buttons, you're going to be able to kind of figure out how to get that plan in there, and it's going to kind of stick with you as you move forward and are actually working on plans. So get that in there. We're going to go review them in the next session, and I'm going to give you a hint. The hint is at the SMART objective level is where most people don't get it right. They typically don't have it specific enough, some measurement, or some time base in there. So always kind of think about, by the end of the year, I'm going to do this. By the end of the summer, I'm going to plant the best looking yard in the neighborhood, or whatever it happens to be. So there's, the criteria in there. So think about that as you get to the objective, and then think about what are the steps I'm going to go through to get to the objective. So that's your homework for the next session. Typically, we like to give you at least a week to be able to do this before we schedule the next session to go through that. So, and if you have any questions or any trouble, or you can't get logged in, whatever it happens to be, please contact me. I'll get you fixed up here. Any questions on the homework?
Hey, Fred, you said we're entering this in the VMSG training sandbox group?
Yes, exactly.
Okay.
Now, if you have a real plan that you want to enter in the regular group, please feel free to. Just let me know, where you're putting it in there. But the other thing you can do is if you enter it in the sandbox, we can move it. So it just takes a couple of mouse clicks to move it to wherever you want it to be. Okay. Well, I will look forward to, again, probably with all of you in there, maybe a week or two, we'll set up the training 3, which is the review of all your plans. And we're going to walk through every one of them, make some suggestions, maybe a little critique in there, just so everybody really understands the process. Because this is the key process in the VMSG dashboard, is getting your plans in the system and being able to monitor your plans. After training 3, after we review everybody's plans, by the way, if everybody enters a plan and we review it, We're going to send you a beautiful certificate to put up on your wall that says you're an operational planning expert. And then we're going to plan the next training session, which is performance monitoring. So how do you manage the plans going forward? What's the dashboard look like? What are the macro and micro level performance monitoring tools? How do we build a VMSG public web page to show the status of anything in the system? So that's kind of what's going on ahead of us here. So if there are no more questions, everybody, and by the way, here's my contact. Oh, that's Andrea's contact, but mine is fred@kc-inc.com. If you have any questions, feel free to email me or message me or whatever, and I'll be happy to work with you on any of this kind of stuff. But I'm going to let you guys go for the day. And again, if you need anything, please feel free to reach out. Thank you, everybody. Have a wonderful day.
Fred.
Thank you.
Thank you.
You're welcome.